Hi, thank you for watching Yoga with Elia. This is Elia, and welcome back to the part 2 of the Key to Lower Back Health video tutorial. And if you didn't have a chance actually to watch part 1, I would really encourage you to stop right where you're at, watch part 1, because what I discuss in that tutorial will help make at least a little bit, if not a lot more sense of what I present here. And so, whereas in part 1, I covered what it takes and what the implications are of having better, more healthy, and more flexible hip flexion, which is to say more flexibility in the hamstrings, so that every time you bend down and pick something up from the floor or tie your shoes, or even just every time you sit down, you're not constantly meeting the end range of your hamstrings and then forcing the compression into your lower back. In this video, we're going to talk about the opposite movement, which is hip extension. And so if this is hip flexion, then of course hip extension is where your leg and hip go posterior to that neutral line of your hip, to the neutral position of your hip. And so when we're discussing any movement, there's of course muscles that drive the movement, and then there's muscles that need to be inhibited, technically speaking, or stretch in order to allow a more full range of motion. And so when we're discussing hip extension in general, there's really only one muscle, a really key muscle, that has to do with allowing more flexibility and extension, and that is, of course, none other than the hip flexors, technically called the iliopsoas muscles, or just the psoas muscles simply. I will probably go back and forth between calling them either the hip flexors or the psoas, and they're going to be synonymous terms for the purpose of this video. Now, in analyzing any muscle, the first thing that we have to understand is what points on the body the muscles connect. Because if we understand what points they connect, or the a muscle connects, then we understand what action the contraction of the muscle provides, what movement, and then what movement the elongation or technically inhibition of that muscle also permits. So let's just take a real quick look at what the connecting points, or to put it more specifically, the origin and insertion points are of the psoas. So when you look at the origin of the psoas muscle specifically, it's a very, very unique kind of muscle origin. It's very unique and it's very interesting because most muscles, not really every muscle, every other muscle in the body, it really connects one single structure to another single structure. And when the muscle contracts, it pulls one structure towards the other structure, thereby causing the movement of a limb. The difference, though, in the psoas, as you could tell from the image, is that it originates throughout the entire lumbar spine. And technically, it actually starts at the lower end of your thoracic spine. But again, we don't need to really know that. It's not going to make a difference in how we move or the technique that we apply, again, for the purpose of getting more mobility in hip extension. So we'll say that the lumbar spine, the entire lumbar spine, is, let's say, encased by the psoas, the beginning of the psoas, the origin of the psoas. And why that's different is because literally every single vertebra and the discs, the intervertebral discs, have connections of the psoas to it. And so I'm going to grab my spinal model again just to kind of make this a little bit more clear. So we have 1, 2, 3, 4, 5 lumbar spines. So from here on down, this is your low back. And so the psoas connect to every single vertebra, and as I said, every single disc. Now that's a very broad origin of a muscle. And there's a very important implication about what this means in terms of our movement, and especially in terms of rehabbing any restrictions or constrictions or even injuries in that muscle. And if we have such a very broad, all-encompassing origin of a muscle, the two implications, the first one is that the size, just the sheer size of the muscle, suggests that it will take a little bit more effort and time to create more flexibility in the muscle. And this is just simply an equation of math. If you have a bigger muscle versus a smaller muscle, it takes a little bit more force to create changes in the bigger muscle as compared to a smaller muscle. And the other very important implication of seeing how the psoas originates at the lower back is that it has a tremendous mechanical influence over the lower back. So whenever we consider even just the subject of lower back health, the psoas muscle should be one of the first muscles that we think of because of this vast and strong mechanical influence over it. But the question is, why is it that the psoas muscle, or how is it that the psoas muscle plays into low back pain? And this really just comes to the question of lifestyle. And I'm going to use actually my TheraBand that I've used before to kind of simulate the psoas muscle. And I'm going to actually grab a dowel and use a dowel to simulate the femur or the thigh bone. So usually your femur would get plugged in right here into the hip socket. And so I'm doing the best I can here to hold the band right at the entire lower back with all my fingers, but you could just use a little bit of imagination and see that the psoas would otherwise attach to every single point as I discussed before. And then it inserts into your thigh bone right at the inner portion of it, at the medial portion or the inseam of your upper inner thigh at a little area called the lesser trochanter. But the most important part to know is that it's on the inside of the leg than on the outside. So where my thumb right here, my left thumb is holding the band, that's where your psoas connects once it comes down from the lower back. So when the psoas contracts, it pulls these 2 points towards each other, which usually causes hip flexion. So this is just simply if you stand and lift your leg up, right? So that's your psoas doing the work. The quadriceps do a little bit of that work, but again, that's just outside the context of what we need to learn here today. The secondary movement, of course, because of the attachment at the lesser trochanter, at the inseam of your inner thigh, upper inner thigh, when you contract the psoas, it flexes the hip. That's the primary function, but its secondary function is it externally rotates the hip because it brings the lesser trochanter inseam point closer to the origin point, so that causes external rotation. So you can just simply test this out by lifting your leg and then externally rotating it. So that is the job of your psoas. That's the active part of your psoas. But as I said, if we're working on hip extension is when you take your leg back posterior to the torso. Then we see that this is what makes the psoas lengthen. So whereas the primary movement of the psoas is going to be hip flexion, the primary way to lengthen the psoas is going to be extension, but the secondary movement of the psoas, as you remember, is external rotation. So the secondary movement that will get us even more flexibility imprinted into the psoas is extension coupled with internal rotation. And I'm going to use these terms again when we actually get to the practicing of the techniques. So just hold that in your mind, and it's going to make a lot more sense in a little while. Actually, I'm going to keep holding this model. So the question was, why is it that the psoas plays into low back pain the way that it does? And as I said, the answer comes in the form of understanding our lifestyle, or you can even consider it just kind of as the geometry of our everyday life. And as I talked about in the part 1 video, the most common lifestyle, the most common pathological type of lifestyle that we have widespread all over the world is the sedentary lifestyle, and the most common body position that has to do with a sedentary lifestyle is, of course, sitting. So sitting is when you have your hip flexed. So it's when your thigh is around 90 degrees or so flexed at the hip. And because we spend so much time in this position, the psoas muscles stay at this short length and remain there for hours on end every day for years and even decades on end without much relief. And what that does to the psoas muscles is it kind of hardwires a certain pattern. So if you place your leg and your hip in that position all the time, your body, your nervous system, everything is going to start to adapt. Adaptation is really the key word there, to the muscle length, the length of your psoas, that's consistent with this flexed position. So that means every time you try to, stand up and bring your leg down into a neutral position, your psoas don't really have an easy time letting go and lengthening because of the amount of time that we spent in this position. And this becomes a problem because when you're standing, the contraction of your psoas muscle stays intact. It stays imprinted. That becomes sort of the new norm of the muscle. It adapts to that shortened state. So when you stand up, because the muscle is still attempting to come back to the shortened state that you've trained into it, and because of where it connects, as I talked about, the upper inner thigh to the entire lumbar spine, it creates a compressive force on the lower back the entire time. So whether you're sitting or standing, that compressive force is consistently exerting itself on the low back. So even when you're laying down at night to sleep, that muscle still has this program really trained in, shortened effect, so you could even create lumbar, low back compression just laying down and not even moving. So that's why one of our main criteria or one of our main protocols for starting to assuage lower back pain is to get length in the psoas muscle. Before we actually get into the technique of how to create more flexibility in the psoas, we have to review again a little bit about what to look out for while we're doing the movements, the techniques and the poses. And so as we did in part one, you're just going to, again, find your lower back. So as I lift my shirt here, your lower back is right above the top posterior edge of your pelvis, and you can feel with one or two or more fingertips right into the center of your spine. Now, as I talked about before, a healthy lumbar curve has a lordosis in it. So what you should feel with your fingertips is a little bit of a cave, so a little bit of a concave. Now, if this is the case, and you feel these ridges of your spine, the spinous processes kind of pushing out through the skin where you can feel these ridges, that means your spine is out of integrity. So we talked about in part one how when you fold forward and you start to reach the end range of your hamstring length, and your hamstring length doesn't allow you to fold hips anymore, to flex at the hips anymore, then you begin to flex and round your lower back, and so the lower back starts to lose its lordosis and get into what's called a hyphosis. But basically it's just flexion, it's a forward bend. And it's not that it's a problem when the lower back flexes, because we do want to be able to train the spine to move in every single direction. That's what sustains its health and its function. It's simply a matter of how frequently throughout the day the spine is taking out of integrity because of the tight hamstrings. But we can lose balance in both directions. So your lumbar spine can lose its balance by flexing too far forward, can lose its integrity by coming out of that lordosis that you just felt, but it can also lose its integrity and balance by going too far into the extension. So again, just to show you, and you can feel along on your own spine with this, you put your hands right on your lower back, and so this is just simply as we talked about before. When you stick your butt out, that's an anterior pelvic tilt, and when you pull your butt in, that's a posterior tilt. And again, a little bit outside the scope of what we need to know for the key to low back health, a pelvic tilt, as different from just pure hip flexion or hip extension, just implies that your torso stays upright while the pelvis is tipping forward or backwards. But if your torso was going forward, if your spine went with the direction of the pelvis, then it's just considered hip flexion or hip extension, not an anterior tilt. But the movement at the hip site is still the same. So again, you put your hands on your lower back and you make a little movement that sticks your butt out, and you go the other way where you pull your butt in. And you notice how that curve changes. It goes from being concave to being convex. And so if you feel when you pull your butt in and you push your lower back out, that creates a convex, and then you come back to more neutral, and that creates a concave. But then if you continue attempting to stick your butt out further and further, you can make the neutral concave lordosis of your lower back become exaggerated, right? So I'm going to exaggerate this, and you can tell, so this is a neutral spine. That's how your lower back should look and feel. And then I'm going to exaggerate so you can tell what an exaggerated version feels like. And you can feel this with your fingertips. You can feel how that concave kind of deepens, and that little cave, the space in your spine deepens. And you know how it actually feels while you're doing the movement. So when we're doing these techniques that I'll show you here in just a little bit, what you want to look out for is when your lumbar curve has become too exaggerated. So try this, and you'll have to do it standing up. What you're going to do is stand straight, keep your feet about hips width apart, and I'm just turning sideways so you can see what's happening. You're going to place your hands right on your lower back, and again, find neutral. So you just stick your butt out ever so slightly until you notice it becomes a little bit concave. Don't go too far. Now, when we're practicing hip extension, the key muscle that drives hip extension is going to be your butt muscle, your gluteus maximus. And so when you extend your hip back, hip extension is driven by the glutes. So when we're testing out right now our hip extension flexibility, we have to get into grips with the action of the glutes as much as possible to see exactly how far we can extend backwards before that lumbar curve exaggerates. Okay, so keeping your fingers on your lower back, find neutral, and now engage your butt, and then just start to simply pull your head back, lift your chest, and bend over backwards. And keep your glutes turning on, and keep feeling with your fingertips right on that low back curve. And you'll notice, it'll probably be pretty soon, right after you start moving, when the lumbar curve deepens. So say you take yourself right to that end range, where it becomes a little bit exaggerated in that curve, and engage your glutes and see if you can create a little bit more hip extension. Again, where you're just attempting to push your sitting bones and your glutes forward, like you're pulling your butt in, and lifting your pubic bone up. So you engage your glutes, see how far you can keep going before the lumbar curve starts to exaggerate. And when it does, assuming that you've given everything you got to engage in your glutes and taken your hips into full extension, when that lumbar curve becomes exaggerated, that's when you found the limit end of your hip extension. So it doesn't really take that much movement before you find where your hip flexors meet their end range of flexibility. And just a little footnote about that is, mechanically speaking, anatomically speaking, I'll grab my hip model here. The standard calculus of how far the average human hip can flex, anatomically speaking, before we start to run into actual structural constraints, is if you go into flexion, that's going to be around 120 degrees. But when you go into extension, the very deepest structurally, functionally, that your hip can go into that position is about 15 degrees, right? So that's about 8 times less than the amount of flexion. That's why you will run into the end range of your hip flexors when you're doing this test a lot quicker. But what I wanted you to do that for is so you notice what the actual embodied subjective experience is of your lower back curve as it begins to exaggerate. Because if you know that as you're performing the following techniques, you're going to know exactly how to adjust the dials of your intensity and your effort so as not to overdo it. Okay, so let's get to it. For the following poses, you're going to need about 2 blocks. You might not need 2, but just have 2 ready just in case if you haven't done this. And these are both going to be lunges. So we're going to start with what I'm going to call a dynamic lunge. So starting from all fours, you're going to step your right foot forward between the hands, and then you're going to come upright with the torso. Now, when you first get upright, you might notice that the pressure directly on the knee from the mat and from your floor is too much to be able to bear and stay comfortable. So you can always fold your mat over sideways like this, or just put like a little bit of a towel, a yoga blanket, something like that down. But when you get to this upright position, start with where your bottom knee is right below the hip, the left hip, and the right ankle is right below the front knee. And you'll be able to expand your lunge once you start to build up the flexibility, but you just start here. And the other point is make sure that both of your feet are not on the same linear track so that you keep your right leg in line to where the right hip is and your left leg in line with where your left hip is so that you have more width in your stance. You have more lateral stability. I would encourage that you curl the back toes under because it does give you more control. If you're more fond of pointing the back toes, just make sure if you're going to do that, you're actually pressing the toenails actively into the ground. So it's as if you were lifting your toes with the back foot, but that action, when it's upside down, means toenails pressing down. So whichever one you pick, just make sure your foot is active. You're going to place both hands right at your front thigh, right by the knee. Place one hand initially, just to start right now, at your lower belly. So if you stick your thumb in your belly button, you want to have the rest of your fingers be just below the belly button, like a couple of inches. And I want you to think about pulling just that part of your abdomen up, in and up. So it's not like you're sucking in your whole gut. You're just gently, but securely, lifting the pelvic floor. You're engaging that lower band of your abdominal muscle called the transversus abdominis. Now, once you have that sensation of action in it, and it might take a little while to build up and just be able to recognize, so give yourself time to appreciate that. You're going to place both hands on the front thigh. Remember, your left glute is the active element of hip extension. So when your left glute moves, contracts, your psoas needs to lengthen. All right, so we're focusing on the psoas, the hip flexors on the left hip right now. With both hands on the front thigh, your arms are just going to help you keep your torso upright. So when I call it a dynamic lunge, that just means we're moving into the frame of flexibility. So you're going to start with an inhale, start nice and tall, kind of lift your chest and your sternum up. And as you exhale, slowly lunge forward, which just basically means try to get your pelvis and especially the front of your left thigh closer to the mat. And then inhale, come back up. Exhale, lunge forward. Now here's the thing. When you lunge forward, you want to make sure to really engage your glute, your left glute. But when you come back up on the inhale, imagine pulling your back knee isometrically forward. So it's not your front leg that pushes you back up to the starting position. It's pulling your back leg forward that pulls you up. And this allows you to alternate between contracting and stretching your psoas, which causes a nice release to the psoas. It creates a response, a reflex, by where the muscle can actually extend a little bit more if you contract it a little bit first. Because when you contract a muscle and then you stop contracting it, that response, when you stop contracting it, actually gives you an avenue into getting more flexibility. Okay, so we're gonna do it 10 times on each side, and then when you do it on your own, repeat it twice. So 10 breaths on the right and left, twice. So here we go. Big inhale. Exhale, lunge forward, engage your left glute. As you inhale, pull your back knee isometrically forward to come back up. And as you exhale, engage your left glute, bring your pelvis and left thigh closer to the mat. Inhale. Exhale. And every time you exhale and lunge forward, make sure that your arms keep your torso from folding down on top of the leg. Because if you fold down, that actually puts more contraction and less tone on the lengthening of your psoas. So inhale up, exhale, lunge forward. And as you inhale, pull your back knee forward. As you exhale, you can actually think about pushing your left knee back and use the glute to achieve that. Inhale. Exhale. So we've done about 5 or 6. Now the next 4 that you do, bear with me here, you're going to come back up, but when you lunge forward, try to engage your left glute so much that you can recognize the curve of your lumbar spine. So you'll know exactly the point at which, when you lunge too deep, when you start to get that same excessive lordosis, excessive concave in your lower back that we analyzed at the introduction. Inhale up, and then pay attention to the curve of your low back as you exhale, lunge forward, engage your left glute. Inhale, pull your left knee forward, back up to the beginning. As you exhale, engage your left glute, keep bringing your pelvis closer to the ground, lift your low belly. And let's do it one more time. Big inhale up. Exhale, as you lunge forward, lift your low belly. Good. And then hands down, and we'll switch sides. So again, just repeating everything from the setup of the first side. You want to make sure to start with your left ankle below the left knee and your right knee exactly below the right hip. Don't forget to keep the lateral distance between where your left leg lands and your right leg lands, so it represents the lateral width of the hips of your pelvis. So again, both hands on the front thigh, lift your lower belly, lift your chest, kind of amplify the elevation of your sternum. Take a big breath in. And as you exhale, you don't have to go too crazy on the first one. Lunge forward, lift your low belly, engage your right glute. As you inhale, come back up, pull yourself up by attempting to drag the right knee forward. And as you exhale, press the right knee backward, which is going to call your glute into action. Inhale, back knee pulls forward, your torso comes up. Exhale, lunge back forward. Keep your low belly lifted. Keep your arms pressing and driving the torso back. Inhale. Exhale. Good. Now, if you can try this with your eyes closed, it kind of helps you feel and get a little more sensitivity in the body. And if they're not closed completely, you can partially close them so as to not overly invest in your visual system, just for now. As you exhale, lunge forward, pay attention to the curve of your lower back. Notice at which point of depth of your lunge you start to get that exaggerated curve. Inhale up, pull your back knee forward to come up. Exhale, push your right knee and your right leg back. Engage in the glute to come forward. Inhale. Exhale, lunge forward. Keep your arms as straight as possible without overly exaggerating your lumbar curve. Now, when I say that, it's going to exaggerate a little bit, okay? Because as you continue to practice extending your flexibility, extending the hip extension range, you're going to come up against those little sensations of when your lumbar curve has gotten a little bit too deep. And so you have to be able to take yourself to that end in order to make any gains and any progress. And so on this last one that you lunge forward with, make sure your exhale is complete, lift your low belly, engage your right glute as much as you can. And then inhale, you're gonna come up, and then hands come down, left leg down. Now, you're gonna use one or two blocks. So we just did a dynamic lunge. Now what we're gonna do is called a low lunge block sit. So you might get away with one block, but if you need to, there's no shame in it. The fact that you're doing it is already a great thing. So you're gonna start again in the same lunge, same parameters as far as the lateral width between your feet and your legs. But in this case, you're gonna keep your hands down, and I want you to see how far you can set your left knee back away from the front heel. And what happens when you do that, if you can tell, is that my pelvis comes closer to the ground, right? So if I straighten my legs all the way, my pelvis will be on the ground and I'll be in the splits. But if I bring my feet all the way together, then there's no way for my pelvis to actually come to the ground. So this is what we're looking for. We're looking to get your pelvis as close to the mat as possible by first and foremost extending that left leg back as far as possible. So when you take your left knee far away from the front heel, that will eventually have its own limit end. And you can unbend some of the angle of the front knee to do this, right? You don't have to maintain this very perfect vertical position in the shin. It can be a little bit more of a diagonal, a little bit more of a slant. But the idea is to get your pelvis close to the ground by setting your left leg back. Now, at this point, you're going to take a block. You can start with this tall setting. As you know, the block has 1, 2, 3 levels. So you're going to take it at the tall setting, the tower setting, and you're going to put that right underneath your right butt bone. And you'll know when you find your butt bone because it has a point and it has structure. And once you get it there, there's no confusion about the fact that you found some structural support. Now, here's the thing. Not everybody can be flexible enough to come down to just one block. So if even at your limit of taking the left leg back into extension still keeps you high enough off the ground to not be able to reach one block height, here's what you do. You take 2 blocks and you stack them right on top of each other, kind of like an upside down letter T. So you do that. Make sure again that you pinpoint it to your sitting bone. And then once you get that, then you come upright. And then coming upright in this position, again, it's going to require that you keep your hands on your front thigh. With the back toes, again, either keep them curled, but if you're pointing them, make sure that you're pressing the toenails into the floor. Let's just start with your right hand right at the front thigh. So you use your right arm to keep your torso extending backwards. Take the other hand on your lower belly, and again, just remind your lower belly to lift so you get that deep structural pelvic and lower back support. And then once you have that, you can place your left hand on the right hand as well, on the right leg. And then you're just going to sit in this pose. And you're going to spend 1 minute on each side. So when you get into this position, it really does feel tempting to just turn off all your muscles and let the clock do its thing. But as you did in the previous dynamic lunge, I want you to firmly engage your left glute because your glutes are the antagonist muscle to your hip flexors. And because our muscles, all of our muscles, are really set up in relationship to other muscles, as I've shown before, is when you contract your bicep to bend your elbow, your tricep has to automatically lengthen. And that's something that we don't have direct control over. It's a nervous system reflex. The same thing occurs in the hip. So if you think about your glute, the same as your bicep, when you contract your glute, the antagonist muscle, it means the opposite muscle, is going to lengthen. And so if the opposite muscle to the bicep is the tricep, the opposite muscle group to the glute are your hip flexors. So when you feel your way into this pose, try to keep a constant and very firm, almost like a very clenched feeling of contraction in your left butt. And you can close your eyes. This pose should be stable. The block here is going to help you not have to manage your balance. So I want you to kind of get rid of any sense of anxiety or hesitation about having to balance in this pose. You should be able to feel like you're just plop right down into the block and it's got you. Enough that you can actually close your eyes and just pay attention to your left glute and the whole left hip. Make sure that you relax your jaw, you relax your mouth. I know that it's been definitely a minute. So let's take a couple more breaths, close your eyes, and really try to capture the sensations, remember the sensations of what that feeling of length and flexibility feels like on the left hip here. As I talked about in part 1, you always want to stay within the safe range of that stretching intensity. So on a scale of 1 to 10, where 10 is extreme and painful, it feels clinical, medical, and 1 feels like nothing, you want to generally stay at about a level 6 or 7 in that challenging, in that stretch challenge intensity sensation. Okay, so we're going to bring the hands down, carefully come out, take the block out, right leg comes down, left leg comes forward, and again, with your hands on the mat first, that's important. You're going to try to get your right knee now as far as you can away from the front heel. So the further that you can sit your right knee back, the closer you get your pelvis to the floor, and once it gets as close as possible, you place your block right underneath the sitting bone, and you'll be able to feel it. So even before you lift your hands off the ground, you should feel that you're supported on that block. And then once you are, one hand at a time, you can start to press up away from your front leg. As we did on the previous side, keep your left hand on the leg for a moment, place your left hand on your low belly, and just kind of give your belly a little bit of pressure with the hand. So it's just to kind of externally remind and suggest those lower muscles, that lower muscle to lift up. So once you get some tone in it, you can feel it. Again, engage your right glute, same way as you were engaging your left glute, with both hands now on the front leg. Exert enough pressure with the arms against your leg so that you don't just give in to folding forward with the torso. And might as well, just for awareness purposes, keep your front toes elevated because it'll make you more considerate of not just what you're doing with your foot, but in essence, what you're doing with the rest of the leg and the hip. Relax your eyes, perhaps to a point where they close, and then we'll spend a minute on each side here. Now, as your right glute stays active, just notice if it was easier to engage the previous glute or this glute. And even do a comparative little bit of analysis just in your own field of sensation between how the stretch and the flexibility of the left hip felt compared to this side. Is this side noticeably more or noticeably less flexible? And if you notice that one side is less flexible, and for example, if on one side you needed 2 blocks, but on the other side you only need 1, what this should suggest to you is to spend more time on the side that needs a little bit more flexibility, that isn't as flexible. So you could do it in 2 ways. You could either start on the tighter side, do the other side, and come back to the tighter side. So you do a total of 3 sets, but twice are on the tighter side. Or you could just simply spend more time, twice the amount of time, on the tighter side. Now, because we're spending a minute on each leg here, the research really shows that if you spend longer than a minute of stretching, it really doesn't make that much of a difference. So this is where I always err back to doing a little bit more repetitions. So increasing the amount of sets that you do instead of just the amount of time, simply. Good. Keep the low belly lifted. Keep the right butt engaged. Let's take 2 more breaths. Also be attentive to any habitual contractions and restrictions in your jaw, like clenching your teeth or like squeezing, pursing your forehead. Keep everything relaxed in your face, and the rest of your body will actually be able to kind of groove in to the experience a little bit better. Okay, and then we can come down, hands on the floor, take your block out to the side. And so with this last lunge, the low lunge block sit, I would suggest do that twice as well. So do 1 minute on each side twice. So we had the dynamic lunges. You're going to do 10 breaths, 10 repetitions of lunging back and forth, 10 on each side twice, and then 1 minute on each side of the low lunge block sit twice. And that is going to definitely be enough to keep you under 10 minutes in your practice doing this every day. Okay, well, those are the 2 techniques that I would highly encourage you practice consistently. And by consistently, I really, really hope that you try to get to it every single day. Remember, it doesn't need to take that long. It really doesn't need to take any more than about 10 minutes a day. I know everybody's busy and time is of the essence, but you deserve to give yourself 10 minutes of time to make your body feel better. And when your body feels better, your mind, your emotional states feel better, and then you're a better parent, husband, wife, lover, grandparent, student, entrepreneur, whatever you are in your life. That is going to come through a lot better when you're not constantly weighed down by discomfort, tightness, and pain in the body. So 5 days a week, no less than 5 days a week, but preferably daily. And remember, I didn't say this in the first part video, hydrate. Hydrate, especially after you do any kind of movement, because when you're breathing, you're constantly expelling vapor, water vapor, hydrogen, and you get dehydrated. The other reason is that your muscle tissue, and especially your spinal discs, are composed mostly of water. I mean, your spinal discs, the intervertebral discs, are composed of like 80 to 90% water. So if we don't feed enough water into the system, these structures start to desiccate. They start to dry out. And then when they dry out, they can't function as well. So do your practice, make sure that you stay hydrated, and come back for more videos. Please don't forget to subscribe. I really appreciate you giving me your time. Thank you for watching, and enjoy the rest of your day. Namaste.